Let's do it.
All right, awesome. We're live. Good morning, good afternoon, good evening, depending on where and when you're watching this Facebook Live. This is the voice and the face of Dr. Tolu Olabintan, founder of Living Spring Family Medical Center here in the awesome city of Mansfield, Texas. I am here again to discuss topics that help our patients live long and well because we believe that the quality of life is just as important as the quantity of life. And I'm excited today to discuss a topic very dear to my heart and conversations we have a lot, doctor to patient, with the one and only Dr. Sarah Pospos. How are you doing, doc? Did I do a good job with that name? How'd I do?
Yes, that's perfect. Thank you
Awesome.
so much, Doc, for having me here today. I really appreciate it.
Awesome, awesome. Now, for those of you who are watching live, please hashtag live. Those who are watching in replay, hashtag replay. And our topic today is Doc, help me exercise, please. All right. Now, Doc, I'm going to ask you kindly before we go ahead, introduce yourself. Who are you? What do you do?
Yes, for sure. So, hi, everyone. My name is Sarah Pospos. I'm a sports psychiatrist, and I'm devoted to helping others optimize and balance their lives by incorporating exercise, nutrition, sleep, stress management, and other sustainable lifestyle techniques through my telehealth private practice in California, which means one, it allows me to see patients from anywhere in California virtually, and two, it's non insurance based. So that if we're a great fit, you won't be restricted or limited by your insurance coverage or situation.
Awesome. And we were talking before the live, like, how you came about this niche or this passion of yours. So that leads me to my next question. Why do you do what you do? You're like a psychiatrist. Like how like tell our viewers, why do you do what you do?
Yeah, absolutely. So I become a sports psychiatrist because, as a former student athlete, I understand firsthand some of the unique challenges that an athlete may face. So, back in the day, and I mean way back in the day, sports is a big part of my day to day, whether it's for training or just for fun. And then grad school came. I resorted to workout classes here and there, hot yoga, cycling, things of the likes. And then medical training came. I resorted to home workout videos, some hit, some strength training here and there. Because of the erratic schedule, the night
I'm
calls, and what have
impressed you
you.
exercised in med school. Shoot. I just want to say that, but okay.
And then I became pregnant and delivered my first baby in the middle of medical training and in the middle of COVID. So I resorted to nothing. All exercise went out of the window by that time. I kept telling myself, one day I'll get back to it. But, as you can probably tell, that one day never came. And during this time, perhaps it's a combination of factors of being a new mom, just medical training, the pandemic, and what have you. But I found myself becoming antsy, irritable, easily overwhelmed, just not myself again.
Mhm.
Fortunately for me, two things happened. As the baby got older, she started to sleep somewhat more consistently. And during this time as well, I was working on my sports psychiatry presentation where I stumbled upon two statistics. The first one is just exercising 1 hour per week can help with depression. And the second one is just one session, one bout of exercise can help with anxiety. And boy, since then, I started to adopt the mindset of some is better, always better than none.
None.
I try to apply this to exercise, to my lifestyle, and just to life in general. And it was very much liberating and such a game changing mindset for me. So my hope is to, by getting this out there, some of you might also experience the liberation and how much of a game changer this mindset could be, including for exercising.
You know, it my next like the first thing that clicked in my mind is that for some of my patients, I'm gonna have to write prescription 1 hour exercise, diagnosis depression, diagnosis anxiety, and do that as a way to encourage because what you just said is pretty profound. Just 1 hour in a week is can help with treating or preventing depression. This is awesome. Thank you for doing what you do. You're pretty amazing. So now my next question is this: I have someone who's watching, like, yeah, good for you. you can exercise and you find it value adding. How would you approach someone who's saying, you know, I don't feel encouraged to exercise. I don't feel motivated to exercise. I don't get it. What would you say to them to start off to encourage them to exercise?
Yeah, absolutely. That's a good question. So I think first off, I would start with the benefits. We all know, intuitively that, hey, exercise is good. Just like we know eating healthy is good, sleep is good, and the list goes on, right? But why is it good? So for the listeners out there, as you probably know, exercise is, of course, good for physical health. It helps lower the chance for a lot of chronic diseases like high blood pressure, high blood sugar, mortality, and things of the likes. But it also significantly helps with mental health. So it helps with, for example, a lot of mental health outcomes like improve your mood, improve your energy, your ability to concentrate, improve your sleep, as well as improving or helping with common mental health challenges such as depression and anxiety, as we talked about earlier. So, it's very, very powerful in terms of its effect. The second thing I would say is I would like to highlight to the patients that hey, some is always better than none.
Mhm.
Sometimes we think, myself included, that we need to dedicate a specific hour, a special hour at the gym, Monday all the way through Sunday, just to be quote unquote successful in exercising. And if we miss just one day, we start to beat ourselves up and say, hey, maybe I'm not cut out for this, let's just stop. But some is always better than none. Third thing I would like to touch upon is, as of right now, the current CDC recommendations, one of the recommendations is to do aerobic exercise of moderate intensity for at least 150 minutes per week. So let's try to break it down. Aerobic exercise basically just means anything, and I mean anything that could increase your heart rate. Yep, there you go, Dr. O.
Dancing, could be dancing.
Yeah.
Mhm.
So dancing, doesn't have again to be a dedicated hour at the gym. It could include your hobbies, just movement like dancing. It could include chores, moving things, decluttering your home, moving things here and there, as long as it increase your heart rate. It could include, walk outside, getting some fresh air, walking the
Mhm.
dog, or walking on a stroller if you have a baby and whatnot. Intensity wise, moderate intensity means that you could still talk during the exercise, but perhaps not sing flawlessly.
Okay.
And then duration wise, 150 minutes per week, which it means that you could break it down however you like. So, for example, only have an hour Monday through Friday. So, perhaps can be done as part of your lunch hour. That could be very much beneficial for both your physical and mental health as well.
Awesome. So a lot of reasons that our viewers can be encouraged to exercise. I'll add, it's also cost effective. It saves you money down the line. Um, and a lot, I don't know any medical condition that exercise doesn't help with.
Mhm.
Most of them, exercise can help. Some form of exercise can help. Your body was meant to move. And so I've had to write prescription for patients, exercise this many times to lower blood pressure. And I've seen the blood pressure numbers come down. And we have to take them off medicine. So these things work. We're not just saying exercise because we want to nag or it's the thing to say, but because it improves your quality of life too. It makes you feel better. All right. So, Doc, my next question is this. So I have things what I call hiccups. Like what's a hiccup? Like, it's a deterrent. It can discourage the actual activity. So hiccup number one, Doc, I have no time.
Yes, yes, for sure. I hear and experience this firsthand all the time too. We're all busy, right? Sometimes it's very, very difficult just to find time to relax, find times to sleep, get enough sleep, let alone to exercise. So, what I'd like to recommend and find it helpful myself is to multitask, quote unquote, by pairing exercise with mundane, kind of mindless work.
I like this.
So what I personally do is I go to Amazon, I bought a small stepper and I bought a floor desk which I put on top of my regular desk, and then I start timer 30-minute timer on my phone. That way I can get my steps in, get those heart rate up while doing some work. So for example, works that include replying to emails, preparing presentations, paying the bills, doing errands, things like that on my computer. And that way I could kill two birds in one stone. You don't necessarily have to set aside a separate time on top of your busy day just to exercise.
I like that. So you can multitask, you can batch. Another one I like is taking a walk and calling a friend that has a gift of gab. You can
Mm,
talk for a while. So that way you're catching up, you're being a friend, and at the same time you're exercising, and it doesn't feel as long because you're talking to someone. All right. So that's
absolutely.
one of the things I enjoyed to do too. Now I have a question from Mr. Any. It says, does that have a cure? I'm guessing you're asking in regards to high blood pressure. I don't know if the word is a cure, but I've had patients get off blood pressure medicine just by changing their diet and exercising and losing weight. So yes, blood pressure can be reversed. Okay. I hope that answers your question. All right. My next hiccup for you, Doc, is I'm already tired. I'm no energy. Why would you ask? Like, it doesn't make sense for you to ask me to do more work when I don't have enough energy. I'm tired. What would you say to that?
Yes, I hear you. For many of us, we often feel drained, right? After a long, long day at work. It's really hard to prep and eat dinner or just to breathe, let alone exercise after work. My recommendations, perhaps, there are two actually. The first one being timing. So, if you often feel exhausted after a long day of work, perhaps change the timing of the exercise. For some, getting those exercise in first thing in the morning as soon as you wake up could work. So perhaps trying to wake up 30 minutes earlier and get the exercise time in. Or alternatively, if you're like me, after having lunch and I'm feeling a lot of food coma, just that energy dip in the afternoon, perhaps you can squeeze it in during your lunch hour. The second recommendation is exercising doesn't it doesn't necessarily have to be a hit session, a very exhausting strength training session, a very tiring aerobic session on a treadmill, running and whatnot. So low intensity type of exercise also is very beneficial for your health, both physical and mentally. um, some examples include yoga and even stretching. So let's take yoga, for example. So yoga involves certain postures that helps with mood. Yoga involves slow, intentional breathing that helps us to switch from sympathetic or fight or flight system to parasympathetic, which is the opposite, which in turn would lower our heart rate, lower our respiration, relax some muscle tension, and just helps us to think more clearly in general and be in that relaxed space. So perhaps switching to low intensity exercise that you like, doesn't have to be something that you don't enjoy, could be an option as well if you're experiencing challenges such as having no energy after a long day at work.
And you know what I've found, even my own personal experience, and in talking to patients, when they exercise, they feel better. So the energy is improved from the exercise. So don't be
Yes.
discouraged. I love what you said. Find something you enjoy doing so it doesn't feel like exercise. Like for me, dancing doesn't feel like exercise. It's fun. So I'll do that. Or for some, it's biking. For some, it's chasing the kids. The whole idea is to weave it in already into what you're doing. You're batching, you're multitasking. You can
Mhm.
multitask at work, you can multitask at home, but just prioritize that. So awesome. So I have another hiccup. And this person is saying, good job, doc. I'm happy for you. You can afford to go to a gym. And they're like, I don't have a gym membership. What would you say to that, doc?
Likewise, same here. I myself don't have a gym membership as well. Um, what I like to do is there are a lot of options out there, especially these days. For example, I like to exercise to free YouTube videos, and on YouTube you can find almost any type of options, right? Like you mentioned, dancing exercises, some aerobic exercises, just get some movement out there, even some strength training, guided strength training videos as well. And it's all free. You could even find ones that you like that don't have too much ads in the middle so that your exercise session can be, more
Longer.
effective and longer. Exactly. An alternative that works for me as well now being a new mom of two under two, the youngest being 8 weeks. So
Oh,
essentially, my
wow.
schedule is dictated by the little guy, right? And I oftentimes I cannot afford a continuous 30 minutes of exercise these days. What worked for me is I get a free timer app on my phone and I set it at 5 minutes interval. And I try to shoot for the whole 30 minutes, right? Because as we talked about earlier, 150 minutes per week could equal to 30 minutes per weekdays. And then I break it down even further to 5 minutes interval. And then I either, or you could either, if you're like me, get those steps in using the small steppers from Amazon, or you could even incorporate body weight exercise like some planks, some squats, what have you, some lunges and whatnot. Or you can mix and match, you could do whatever you want essentially. You could do a lot of things without having to do it in the gym with those gym memberships.
And for those who of you who are watching who are like little averse to dancing, I mentioned earlier, there are different types of dance. There's Bollywood, there's even kickboxing. If you want to learn how to do line dancing, like there are so many genres of dancing that you can use as a form of exercise. And I love what you're saying about the free resources. YouTube is amazing, so there are a lot of resources to do at home, and I'm so impressed with you. 8 weeks, wow! Thank you really for coming. Really, because that phase is, oh my. All right, Doc. So I have one more question. So I have someone who, and I get this quite a bit. Well, I work from home all day. Like so I'm sitting at the desk and I'm staring at a screen for 8 hours, usually at a stretch. What would you say to that person? Like, how can I leave? Because by the time I'm done, I don't want to do anything else. I've been home all day. What would you say to that person?
Great question. And especially, these days with the pandemic, when even though things are starting to return back to in person, a lot of us are still working from home, right? So what I would do and recommend in that case is to try to weave exercise in within your work day or work period. And what I mean by that is, first and foremost, exercise again doesn't have to be a dedicated exercise hour. It merely means, if I may put it that way, physical movement, right? Being physically active. And it doesn't necessarily have to be aerobics or strength training. It could be a little dancing session. It could be just moving and getting your heart rates up. So, and stretch, even stretching, or do some yoga poses as well. So, if you're working from home, which means a lot of time it's just sitting in front of your computer, some alternatives that may work, perhaps get a standing desk or put something on top of your computer to make it a standing desk, and then try to kind of just move around, after 30 minutes, maybe set a timer, do some stretching, try to walk around the room if you can afford it. Perhaps take your lunch hour outside, walking outside with some fresh air. It could help with creativity as well as some just feeling relaxed in general, help with the work as well as the well-being side of things too. um, Perhaps if you have a longer lunch hour, you could do the YouTube sessions that we talked about since you're at home, and just get back to work after. Since now you don't have a commute time, perhaps you could use those commute time to squeeze in some exercise as well, perhaps in the morning commute time or in the evening commute time before dinner. There's a lot of ways, I think, to incorporate exercise, and especially it helps if we start to think of frame exercise as just physical movement or being active instead of exercise per se.
All right. So you've heard the doc. Get moving, right? We got to weave it in, put a timer. A lot of times, I have to encourage patients that you're allowed to take, I know, breaks from staring at the screen. I know your job has factored that into your job. So put a timer. 15 minutes is actually not as long as people like. It's not a whole lot of time, but just take the 15-minute break and use that to do something for yourself. You actually
Mhm.
feel better and more engaged or strengthened to go back to work and be more focused, like she said. So weave it into your work time, so that way when you're done for the day, you're done your exercise batch for the day as well. So it's a win-win. This has been very, 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 very good. I've learned quite a few things myself. I hope you guys took notes. And be sure to share with those who will find this useful. Encourage people, your loved ones, and their loved ones to get active because you know it helps them feel better. You know what it makes for improved quality and quantity of life. Now, that being said, Doc, someone's looking at this and is like, wow, this doctor is amazing. I would like to work with her. And I can see her virtually. How can people connect with you, Doc?
Yes, absolutely. So, um, I just wanted to preface this by saying, for some of you, perhaps the tips that we discussed earlier would be enough, but for some, they may need additional help. That just that extra push, incorporating exercise or perhaps other sustainable lifestyle changes, just to take their mental health and well-being to that next level and become the best version of themselves again. Having said that, there are two ways to find me. If you're in California and you don't have a psychiatrist, feel free to reach out. I can be found at my website at lifestyletelepsychiatry.com. If you're not in California, I still do offer additional free resources at my website, lifestyletelepsychiatry.com/subscribe. And either way, you can always contact me on Instagram as well with the same handle, Lifestyle Telepsychiatry.
Awesome. And I recommend, signing up because you get little reminder emails and reminder like, hello, let's go ahead and get active, get moving. And I was in a group session one time and just being encouraged by the group to do something, I was able to finish it, something I've been holding out on doing for weeks. There's power in people keeping you accountable. There's power in people supporting you in your health journey. So build that support system so you're encouraged and empowered to make better choices that help you in the long run. So thank you for what you do and thank you for sharing these resources. And again, I do appreciate you for coming.
Absolutely. Thank you so much, Dr. O, for having me today. And I just wanted to also mention to all the listeners out there, if you're in Texas, if you're in the area, feel free to reach out to Dr. O to receive the best care in the area as well.
Thank you, thank you, thank you, thank you. From her mouth to your ears. If you're looking for a thorough, passionate, and a thorough and caring family physician here in the Mansfield, Texas area, I am she. Thank you all for watching and have a good one. Bye, Doc.
Bye.
All right.